Ladies and gentlemen, the journey for focus, clarity, and mental mastery is about to begin. Live from WSIC Studios on the shores of Lake Norman, the show that gives you the tools to think sharper, sleep deeper, manage stress, and unlock your full mental potential. This is Your Brain Matters. And now, with over 30 years of brain science, more than 70,000 brain analyses, bringing neuroscience to everyday life, here's your host, Dr. Tim Royer.
Hello, hello, hello.
And ho, ho, ho.
Yes.
Santa Claus is coming to town.
It is coming on us whether we like it or not.
Yes,
Here comes Santa.
7 days and counting.
Do you think Santa's brain matters?
Holy cow, yes.
I would think it does.
Absolutely. And all the elves, too.
That's true. Yeah.
All the productivity.
It's crazy.
It's depending on that autonomic nervous system, whether we're going sympathetic, parasympathetic.
Mhm.
Oh, man.
Yes,
we should do an episode about
Santa. We can bring him in.
the North Pole.
See what he says.
Yeah.
We have a quote about your brain matters, but it's not from Santa.
Oh, yeah.
Yes.
Yeah, true.
So today's episode, we're going to be talking about medication and the autonomic nervous system and why the brain can do things without chemistry. We're going to learn about that next week. But this week, we're going to talk about how these medicines affect the brain, good, bad, and the ugly. But before doing that, let's get a few things out of the way. We had a great lecture yesterday.
Nice time of learning, being together. I recommend it still. Next time it's in the area, you got to come.
Yes, the Verdict Ridge one, fantastic. We have one tomorrow on Friday the 19th.
Yes, you just have to travel.
Yes, in Naples, Florida.
In
Naples.
Where it will be a little bit warmer, and Doc's going to deliver the goods.
Yes.
Tomorrow
You
night.
can say, Doc said I have to go to Naples. You tell your wife or family, hey, it was prescribed. I've got to go to Naples for my Reclaim Your Brain. That's at 6:30 at the Courtyard by Marriott. And if you want to attend, RSVP, if you know a family member, somebody down there,
Right.
616-341-2299 for the Naples lecture.
Okay, perfect. And then are we still doing grand opening of the office in Birkdale?
Yeah, can you believe that?
Yeah, we're still doing it. We're still offering half price assessments because we're celebrating our grand opening. So please take advantage of that before the end of the year. So that one, you do need to go to register at yourbrainmatters.today.
Yes, not .com.
.today.
.today. Yourbrainmatters.today. And typically that's a $500 assessment. We look at 3 areas of the brain. We look at 45 different brain waves in each area of the brain. So
Right.
that's 135 different brain waves, how they impact your sleep, your creativity, your stress, your focus, your memory. We look at all those brain waves.
Yep.
What else do we do during the assessment?
We do what we call the power assessment, but what we do there is we analyze the breathing, the biomechanics of the breathing and the consistency, and then how your cardiovascular system responds to your breathing, because they're working together all the time. And it's a beautiful synergy when it's good. When it's not good, it's kind of a little bit like a push me, pull you kind of a thing, and we don't like that. So we want to find out where you're at, and then we want to let you unleash the goodness that can come from the training.
Yes,
Yeah.
absolutely. So
Yeah.
we look at all these variables, and then I sit down with you for about 45 minutes. This is after we've collected all the neurological, cardiovascular, respiratory information, and we just talk about where you're at,
Yeah.
where I see the brain going, compare you to tens of thousands of people in our database to give you an idea of where am I right now, where this is heading, and it's great. So normally 500. We're doing that for the grand opening for 250.
Yeah,
So
yeah.
the way we get to that, like you said, yourbrainmatters.today.
Yep.
Yeah.
So super, super good investment in yourself. And a great way to start the new year, because, I mean, if you don't know,
Yeah.
the lay of the land? How do you decide how your journey is, where you're going to go, you know?
Yeah.
So this is so, so important. And so many times it's so validating and motivating too. I mean, our human bodies are stinking incredible.
Yeah.
And it's the problem is you don't really realize that you have a lot to do with that
Yeah.
and that you can make yourself better through your efforts. And with technology, like we can measure, we always say this phrase that you can't manage what you don't measure.
Yeah.
So anybody who's like making the list of New Year's resolutions, like if you're not measuring things, how are you making those resolutions? Because those would be related to what's been measured. And so anyway, that's a big area that we love. So Doc, let's go into our quote of the week.
Yeah. Yeah.
It's so fun because we picked the person last week, and then this person ended up having an incredible
Was it lights
weekend
out?
last weekend. Just
Thursday night. It was last Thursday night football.
Oh, so it was
You
right
remember that?
after we met. It was
Yes.
right after
Yeah,
our last show. So this person is, we can say this name because he is willing to share. Kirk Cousins had an amazing game
Yes.
with the Falcons last Thursday night. Demonstrated his ability to stay in the zone in the most tense of situations. And so we're just thrilled for him that he had such a great game and such a tough opportunity. But we know him and we know that he is an incredibly brilliant human. And just when he harnesses what he has, what he has been given, he is an unstoppable force. And he wants to be that in all areas of his life, not just on a football field. And so it's really, really been a joy to work with him and see the things that he's been able to do. But let's hear, what did he say about, does his brain matter, Doc?
Yes. So I texted Kirk and I said, hey, why does your brain matter? And he said, my brain matters because it makes me who I am. I need it to last as long as I do. I want to make choices today and every day that give my brain the best chance for a lifetime of success. Sleep and diet habits, breathing patterns, thought patterns, and stress management all must be factored in when I consider the long-term health of my brain. How about that?
Jeez. He basically addressed everything we've talked about
Yes.
so far in our episodes. So, like, especially thinking about what we were saying last week about the autonomic nervous system.
He's all over it. And to think for him, if you know anything about pro football, he's been on quite a journey with his Achilles heel, blowing that out and having to go through rehab, and then them signing the top draft pick, and just all kinds of just chaos in his world.
Yeah.
And all of a sudden he's put under the bright lights.
Yeah.
I think it was something like 4th and 20.
Yeah, I think it was.
Some crazy thing. And, and then he threw so many yards and just did so well. And there's so much to Kirk, more than just football.
Yes.
But he really understands that upstream, he has to take care of his brain in order to manage things that are downstream. It's not just focusing on the behaviors, but it's how is the brain, the body working? How's the autonomic nervous system working?
Yeah, absolutely. He's exemplary in how he takes care of that.
Yeah.
All right. Awesome.
Can't wait for the next part. Let's go. Science Corner coming.
Okay, welcome back. And our next section is the Science Corner. And we are going to take about 12 minutes and we are going to talk about how medication impacts your life.
Yeah.
So initially how it impacts your brain, but then how your brain impacts your body. And it flows so perfectly from what we talked about last time with the autonomic nervous system, because the big concept of today is that your medications are actually systemic and they go into all of your systems, which we talked about last time.
Right. Yeah, exactly.
So the big aha is, if you have a headache and you take a Tylenol, your left pinky and your right big toe might also start feeling better as well because it's going in your bloodstream, it's going everywhere. It's going to be accessed by every cell. So that's really cool when it's a Tylenol, but
Yeah.
that might not be so cool with some of the other medications that we take, in which case then we land in the world of side effects, which is basically where our body is all affected by the medication and we're getting effects from other organs than the ones that we were aiming at. So it's we've often talked about it about like buckshot, the spray
Yeah,
that just
yeah,
is
yeah.
going everywhere. But let's go back a minute. I know for myself, being a nurse in a pediatric hospital, I have given a lot of meds,
Mm-hmm.
a lot of drugs.
Chemotherapy, all kinds of stuff.
Yes,
Yeah.
and things that would sedate you in 2 minutes flat and things that would wake you back up
Mm-hmm.
and everything in between. So I have had my eyes witness what can happen with when chemicals go into our human body. The effect is very powerful, and I think my experience with that has made me always look at what I put into my body because I've seen it and I understand what's happening there. But tell us a little bit, Doc, about your experience with medications. You come from a non-medical background, but you were working in a medical arena at the Children's Hospital, and it's actually your experience in that arena that has us sitting here today.
Yes, absolutely. If we rewind to 1994, okay, is when I finished up my doctoral work and got a great job as a division chief of a large children's hospital. There, the interface of neuropsychology and medicine, was very clear, helping physicians understand what was going on with kids. But very quickly, we would see at the children's hospital these kids that would come to us and they were over medicated. So they'd be on the ICU on life support because somebody for this 4-year-old had decided to give him triple the amount of a stimulant or try to, put him on something because they thought he might have bipolar disorder, which is crazy to think of. And you would start to see, I would get called in the middle of the night to go up the ICU and try to sort out what's going on with the brain, and started to see the dark underbelly of this just going rogue with these medicines. And so that kind of set me up to say, is this really the only way that we can make the brain stronger? And the bigger thing that was happening, these two play hand in hand, and they always do in Royer Neuroscience, is the assessments that were making these diagnoses were absolutely ineffective or they weren't extensive enough. They were, 20-minute assessments, 15-minute assessments to say this child has ADHD and then decide to knee-jerk medicate the brain. First of all, get the assessment right. And two is that really what we need to do is medicate? And so when we talk about medicine, we've been talking about the autonomic nervous system, and it's not that complex, really. And a lot of these meds haven't changed for 30 years. They just
Right.
get branded, they get a butterfly put with them, or they turn a different color. They're just another name for these medicines.
Yeah.
But they've been basically nothing major has happened since the onset of the SSRIs in the early 90s, right? And they either make you go faster, which is sympathetic, or they make you go slower, which is parasympathetic.
Right. So I know we're making a big, broad, sweeping statement, but literally, probably 95% of all prescription medications are doing what Doc just said. They're either speeding up a system or slowing down the system. And there may be people who say, no, 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 it's not a stimulant or it's not a sedative. But then it's probably a precursor to that.
Yes.
It's somewhere along the cascade of that response. And the bottom line that we want to share is that it's affecting every system in the body. So wherever it is in the cascade, whether it's the cascade that's going sympathetic or the cascade that's going parasympathetic, it's affecting every system. So if you don't understand that, then you should look up the list of side effects.
Yes.
Because these chemical overrides that we're taking that are our medications, they will have effects and side effects. I call them all just effects, but some of them are desired effects. So then that's where the pharmaceutical company is going to say, we have the desired effects, but then the list of side effects, those are just the other effects to the other organs that are also experiencing the chemical override. So when I look at that, I start to think, well, there's a kind of a defining line I have, and that is, what is broken
Yes,
that we are
that's a great
fixing
point.
with this medicine? And often it isn't something that's broken, it's something that needs some support. So that's an area where you and I would say, we're not against medicine. Medicine has a place. But what you were running into was a situation where the conventional system was using medicine to fix something that they were saying is broken,
Right.
right? And you were saying diagnostically, it's not broken. Like, it needs support and it needs to be strengthened. It needs to be increased in its resilience. In the meantime, maybe a small dose of medicine could be helpful. But what Doc was seeing and what we were seeing in our practice 25 years ago, it was all about kids. We were treating ADHD with our biofeedback and neurofeedback. And we were on a regular basis working with little kids on 3 prescription meds.
It's just nuts.
They were medications that I told Doc I wouldn't take myself. Like, I'd be sick as a dog if I took what these kids were taking.
Right.
And so they were waking up in the morning. This is not unusual. They were taking their stimulant. Then in the afternoon, when the stimulant was wearing off, they were kind of raging. And so they were put on sedatives. And then after a couple months of that, they had depression and they were put on antidepressants. So we always saw this like triple cocktail. And, you know, these are kids. They're not choosing that pathway. We're choosing it for them. So we were pretty passionate about pushing on the biofeedback, neurofeedback to work with the autonomic nervous system and help these kids build something that's resilient and that's able to function in real life, versus what we were feeling was Band-Aids and Band-Aids, but honestly wasn't helping the kid in the long run.
It wasn't. These were warning lights.
Yes.
And people were covering the warning lights up, getting rid of, chemically altering it, but not actually fixing. Like, if I go to the mechanic and I need it says check engine, and I pull out and there's a piece of duct tape over the light, and I say, what's the deal? He said, well, you can't see the light anymore.
Yeah.
Well, wait a minute. You're supposed to check the engine. So let's give a couple examples of some medicines.
Yeah.
So a lot of times people will experience anxiety, which is a symptom of a sympathetic nervous system.
Yeah.
They go into their doctor,
Yeah.
and the top 3 benzodiazepines are things to calm them down.
Right.
And they should be asking, well, why is my system work up? Xanax, Ativan, Klonopin. Okay.
Yes.
So these are going to push the nervous system chemically to the parasympathetic state. But we have to ask, what is it ultimately doing to the brain? Because your brain matters. Your brain matters.
Yes.
The symptom changed. They went into parasympathetic. But let's just give me the list of the side effects, Aim. What are some things?
So while the person may be feeling like, oh, a relief, everything's calmed down, the most common side effects are fatigue. This person's going to get up in the morning and be like, I haven't rested. Cognitive slowing. And this is very common, where you can't find the word. You can't keep up with your peers. Memory impairment, super common. Oops, I forgot this meeting.
Yes.
I can't remember so-and-so's name. And there's dizziness, which is these are very common. And most often in our society, like, we're being told, well, you know, it's okay. You'll get used to it. You'll get used to it, and it'll, you know, then it'll be fine. But we need to be thinking about, why are we dizzy? Why is our brain slower? Why are we not remembering? And is it worth the effect, the good effect that you're getting? Or is there another way to get that? It also really is bad for your sleep, which is really bad in the long run. Yeah,
because you're not getting into the right stages of sleep. And then what happens a lot of times is these people say, well, I don't have as much energy in the morning.
Yeah.
So then these stimulants start to get introduced. And again, we're not opposed, but let's fix it. And next week, we're going to talk about how we actually can fix this.
Yeah.
Okay. We're not just saying bad, 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 bad. We're saying there's a greater thing your brain can do besides just be chemically altered. 3 top stimulants: Adderall, Ritalin, Concerta. And so then you've got now these things that push you into sympathetic, kind of cheat you to get some focus. But then what are some side effects from that?
Well, the most common are anxiety,
We're back to anxiety.
elevated heart rate, sleep disruption, and appetite suppression.
Yeah.
Let me just tell you, those 4 things you do not want in a child's
No,
body.
not
It
at
is
all.
absolutely terrible for growth and development. And so we should be thinking there's I'm afraid this is pharmacological abuse of a growing little body. So we need to be more careful. We really do. And we need to advocate for ourselves, but also obviously for our children. So we have a few other substances we didn't get a chance to talk
Yes,
about,
we do.
but maybe we'll drop them in the next segment because we wanted to talk about a couple things that are common that you might be wondering how they affect, and they are caffeine and marijuana.
Oh boy.
So
This
stay with
sounds like
us
a fun
because
segment
this
coming
sounds
up.
like a good segment
Really?
to stick with.
Do you mean those change my autonomic nervous system?
Okay, welcome back. And we said 2 words when we were leaving the last
Yes,
segment.
yes.
We said marijuana and caffeine.
What?
I don't think there is a person on the planet who doesn't recognize those 2 words, right?
Exactly.
Okay, so we just thought it would be fun to make sure that no one out there is thinking this doesn't apply to them or their loved ones. And so we thought about 2 very common substances that we
Not
would.
that we're saying everybody's using marijuana.
No, I didn't say that.
Okay.
But you probably know someone who is.
I do.
And
there's a lot of hotel rooms I go in that's like I can tell somebody was in here. It's like, are you kidding me?
if we understand it, then we understand the people around us better who are
Yes.
using it. So I
Yeah.
think it's good to at least talk about it because it's a really, really common part of our culture. Also, people don't think of it as being a drug or whatever, but what we want to do is put that in the category of a chemical override.
Yes.
These are all chemical overrides. And I'm telling you, you can just go to CVS. You don't need a prescription to get a chemical override.
Right.
There's a plenty of them on the shelves there. I mean, another easy one we could talk about, but we didn't plan on it, is Afrin. Let's just all spray this up our nose. And yes, we'll have some clear nostrils, but we'll have like a range of side effects, so we just have to remember the topic today is we're talking about how chemicals affect our nervous system and thus affect our entire human being. So, and it's really important to be knowledgeable about them so that you can make the best decisions. Okay, so Doc, we've had plenty of clients who are users of marijuana,
Yeah.
for better, for worse. So just give me some feedback on what does that look like? How is that good and how is that bad?
Yeah. So we go back to the autonomic nervous system, right? I mean,
Yeah.
all roads lead back to the autonomic nervous system. And we want you listeners, because your brain matters, to know how this thing works. You get one brain. There's not a replacement on aisle 3 at Harris Teeter, okay? You get one brain. And so a lot of times we find some relief from these different chemicals and we think that that's the solution, but we haven't fixed the problem. So what happens in marijuana usage many times, and you can see this in the EEG, you can see both what causes the desire to want to use that as well as what happens when you use it. So in the EEG, you have all these different frequencies, and when the person starts to go into the fast frequencies, 20 hertz and higher, you can see that acceleration in the brain. And that feels anxious, restless, disruptive, much like the person who's maybe taking a benzodiazepine. And they use marijuana, and literally the frequencies in the brain, the fast speeds will drop, and then some slow speeds, some parasympathetic brainwaves, particularly alpha waves. These are between 8 and 10. And the interesting thing is alpha ranges from 8 to 12, and the lower end of it is just kind of like floating imagination. It isn't very productive. Like,
Yes.
hey, let's have a McDonald's on Mars. Okay,
Yeah.
well, that doesn't get me any place. But then 10 to 12 is really productive. That's where we get iPhones and Teslas and all that kind of stuff. But what marijuana does is it makes the 8 to 10s shoot up. The person feels like they're coming up with all these great ideas. They're actually awful ideas, okay? But they feel calmer because they move the nervous system with the use of the marijuana. But I can see it on the EEG. They come
Absolutely.
in, I hook up the EEG, I'm like, I wonder what this guy was doing before he came in.
Right. Right. And what we've heard is people saying, because when they get better, then they'll look back and say, the most common thing I've heard said after someone comes off of using marijuana is marijuana made everything feel easy, but it made everything hard.
Yes.
They couldn't get a thing done. It was so hard. And that's because the brain can't access the waves that it needs to do things.
Yeah. The
So
faster
you are
ways.
literally handicapping yourself by trying to help yourself. So
Yep.
hopefully that was interesting. But the polar opposite of that is our culture's use of caffeine.
Oh, we can't talk about this.
Caffeine is a drug. Okay. And we use it. Like, we are users of
Yes.
this drug. But something people might not know is like, oh, the caffeine doesn't affect me. I've heard that definitely. I don't have that. You do have that.
Yeah.
Your body has figured out ways around it, made compensatory mechanisms, but caffeine is a stimulant. It does all of the things that we talked about regarding the stimulants.
Yeah.
And it is detrimental to you in the long run. Now, there are studies that show a cup of coffee in the morning is actually very good for the body. And it does make sense because it kind of wakes up all the organs. But we are a cyclical creature, and we have to have the flip side of that. And caffeine interferes completely with the revving down side.
Mhm.
And a lot of people say, oh, that caffeine it lasts me like 2 hours, then I need more, or whatever. That's not scientific. Caffeine is in your system easily within the higher ranges of effect for 6 hours. And then it's in your system another 6 hours in the low ranges of effect. So even when it's subclinical, like I don't feel jittery, my heart rate is still elevated slightly. So it's nothing to play around with. And it definitely affects all your systems, like down to even your digestive system. It's going to interfere with your bowel movement regularity, for
We
heaven's
can't say
sake.
that on the radio.
You need
Can you
to
say bowel movement
think about that.
regularity?
Yeah.
Okay.
Yeah.
Okay.
We need to make sure we are not messing around with our body's cycles, and pooping is part of a body cycle.
Yeah.
And so we need to keep things regular. And if you're interfering with that, you probably should reconsider.
Yeah.
Okay?
So we're not saying that you can't have a cup of coffee
No,
here and
no.
there, but
Mm-mm.
we're saying if you're using it to compensate, and you're going to learn about this more when we talk about sleep, we should have a burst of cortisol or adrenaline in the morning. We
Yeah.
talked about the negative side of cortisol, but there's a cyclical pattern. We should have that burst. And a lot of times what happens if we're really dependent on the caffeine, there's something probably off in our adrenal system.
Yes.
We're not pumping the adrenaline, so there's a broken mechanism.
Yeah.
And we're trying to fill that gap. And then ultimately, we're just putting a piece of duct tape on it and not figuring out, well, why is my energy not good? We get tolerant of the caffeine. Now we need more and more and more. And now it becomes an energy production issue
Yeah.
where our body isn't making the energy, this chemical substance is.
Yeah. And those are just a few of the really tangible things. Like there are other things within our body that we're not even aware of that are happening when we shove ourselves into sympathetic and shove ourselves back into parasympathetic, because the body has its own healthy compensatory mechanisms.
Yeah.
But what we're doing is saying, this one works faster, this one's more accessible, let's just do it this way. And anytime you interfere with the body's natural compensatory mechanisms, you're going to cause problems elsewhere. So those were just some really big principles that we wanted to talk about medication. Doc, you have 2 minutes.
Okay, let's try
I
it.
wanted for you to share a little bit about a medication journey that you've done, and how do you feel like that relates to what we've been talking about today?
Yeah, so I had noticed a couple years ago that I was starting to have higher blood pressure. And so I went into the doctor, and he started talking about it. He said, I want you to take this medicine. I sort of knew I was a little bit on the heavier side. I also knew you've been telling me that I've been snoring a lot.
No.
Yes, you had. And I was like, maybe I'm not, getting enough. But sleep apnea, that kind of stuff definitely impacts blood pressure.
Okay.
But I went the route that he told me, and I took the blood pressure. And the first thing I noticed, my blood pressure came down 10 points, wasn't huge, but I started coughing all the time. And this ACE inhibitor causes that. And I'm like trying to do lectures, and I'm
Oh, yeah. It
It
was
was
ridiculous.
ridiculous.
I had got Doc trying all these different cough medicines. I'm trying anti-inflammatories, anything. And then we figured it out. We're like, wait a minute. It started with this medication. And we're going to talk a little bit about the next med and then the next med with Doc in our next section, because this was quite a journey that you were on, right?
Yeah. And it was like, okay, did I really benefit? And I kind of knew I need to take care of some stuff. I need to take care of my weight. I need to take care of my sleep. I need to get my breathing program running. And I knew that was running in the back of my mind. Like, am I just putting a piece of duct tape? But the duct tape I put on actually started affecting other parts of my body, which these medicines do. They affect every cell in your body, whether you like it or not. And your brain matters.
Okay, guys, we finished off that last segment. We were talking about Doc, and it's really good. He's telling us about his blood pressure medicine journey, which I just have to laugh because I was like definitely encouraging him in this direction. We got to take care of this. Our daughter was like, Dad needs to take care of his blood pressure. I'm like, what is this? We're healthy people. Why is this happening? So it was just a really like mess because we work in this field, biofeedback, neurofeedback. You think we could manage everything with it, but we couldn't. So we're still banging up against the wall of the high blood pressure. So Doc, what happens next?
You are so fun. You're like giddy because we're talking about me and
all your problems.
You can, yeah. Oh,
No.
Great! I get to tell the world that I've been laying in bed and he's snoring and I can't sleep.
Gosh, my life.
And that's where this is going to go.
Well, it's a learning experience for all of us because initially when Doc's blood pressure was scooting up a little bit, I was like, I think you just ride this out, like I didn't really know. And my daughter's like, Mom, you don't ride out high blood pressure. Like you need to have that taken care of. That is not good for your heart. So this was one of those things where it wasn't like, okay, toughen up. Because a lot of times I'm in the toughen up category.
Yeah.
So this one was a little unusual for me to like feel like we do need to go to the doctor and get you on a prescription. So anyway, first prescription, coughing.
That was ridiculous. It was it was just like I'd be given a lecture and I'd just be like, what is going on?
And we just acclimated to it. Like we decided it was our new normal. But anyway.
So finally I'm like, enough of this. Enough of this. So I go into my doctor. Great guy. I love my doctor. And he put me on he says, yeah, that happens a lot with these medicines. I'm like, oh.
We didn't read the side effects.
Maybe I should have read
We did not. We didn't.
So he gives me another one.
Yep.
And I'm like, within maybe a week, the cough.
No cough.
The cough was gone.
Yep.
I still only dropped like 10. I'm like 10 points. I know if I do my breathing program that we do, that I can drop 21 points. We did that for a insurance company once. I'm like, just buckle down and do your program, Doc. So I get 10 points. I'm like, this is pretty weak, and I'm doing good.
Yeah,
right. It's working. And we had my son who's in the military. He was home from Japan. He and his wife, and we're sitting there on the couch, and I'm like, man, my ankles itch a little bit. And I lifted my ankles up. My son is a physician, and I put him on the coffee table. I mean, they were like 2 to 3 times the size. It looked like an elephant.
Looked like he was a pregnant lady in the 8th month. It was hilarious. I mean, we do laugh at stuff like that. Like we literally just laughed at it. It was so funny.
And I said to Joe, I'm like, Dr. Joe,
what is going on?
Is this normal? And he's, oh boy.
Yeah.
He says, let me guess, you're taking this blood pressure medicine. And I'm like, yeah. Is that normal? No.
It's a side effect.
That's a side effect.
Yeah.
And he's like, you're going to have to get off of that one.
Yep. Yep.
So now we've had two things. And you remember, guys, everything we put in affects every cell in our body.
Yep.
And your brain is not, I'm speaking to myself here, your brain is not a dartboard that we just like, oh, let me try this and see where it lands.
Yeah.
Your brain is a precious, wondrous gift from our Creator. You are fearfully and wonderfully made. And so we got into this third medicine, and it wasn't really doing a ton. I didn't have any side effects from it. But
So that would be considered a big success.
yeah, most people I think would have been like,
And then you take that the rest of your life.
yeah, like,
That's, yep,
what's my exit strategy, doc?
right.
When do I get off of this? Oh, exit strategy. What are you talking about?
No, that would have been considered just a home run.
Right.
Yeah.
Think about that next time you're in with one of your kids and you're getting your stimulant refilled. Say, hey, doc, what's our exit strategy for my child? Is he supposed to take a class 2 amphetamine the rest of his life? I mean, in the same class as speed and these other things that are controlled substance, but, with no exit strategy. And the more I thought about it, I'm like, it's time to crack down and start working on this.
Right. Well, that's not exactly how it
Really?
happened.
Well, you kept
So I kept nagging.
nagging.
Okay.
No.
So how it really happened is that
Okay.
we thought the med was working good, right? And we're pretty satisfied. And so then I had been patiently waiting for the perfect time to talk to Tim about his snoring because
Yes.
we in our work talk about sleep nonstop and the value of sleep, as we've said on this program, second only to oxygen.
True.
Meanwhile, I'm sleeping half the night because the second half of the night I hear Tim snoring. So I've been thinking through this, and he's tried a few things that haven't worked very well, but
Right.
I, for some reason, can sleep the first half of the night, and the second half I can hear him. So I came to him in very serious fashion, and I said, I'm thinking about sleeping the second half of the night in another room. So I'll get the first half of my night's sleep with you, and then I'll go finish sleeping.
I don't like that idea.
Oh, suddenly there was about 7 options in play that he was going to do immediately. So tell us a little about that, Doc.
Yeah, so we tried these different things. We won't get into them all, but we worked on elevation of the head, worked on recording the snoring at night. Great app called Snore Lab, mouthpiece, and it did some different exercises, which were kind of cool.
Yeah.
Different exercises.
And a brace. on
Yeah,
your
we
neck.
had the brace. We tried all these different things, and we would measure each night the snoring with this wonderful app. And my first reading was like a 25 or 30, which is really, really loud. And I said, it was you, it wasn't me. And she said, but I could go back and I could listen to it. And I'm like, oh my gosh, this is a
Nice.
problem. So then we started to try these things, and I started testing them
Yeah.
and
Collecting data.
And all of a sudden I tried something and we were at like a 10
Yeah.
on the snore reader, the recording. And so then all of a sudden we put this combination of things together, and it had gone away. Like I'd fixed it, right?
Right. With all the supports.
The
we're doing.
supports we were doing.
And so then, I'm like the happiest person in the world because
Absolutely.
I'm sleeping.
She said, now I'll do the radio broadcast with you.
I'm sleeping like crazy, and Doc's sleeping better. And so then randomly, he starts checking his blood pressure.
Unbelievable. With the sleep.
Yeah.
And what happened was the sleep, I've been trying to lose a few pounds. Well, all of a sudden I just start losing pounds like nothing.
Yeah, because that's one of the things. Like if you sleep better, your gut digestion is all
Yeah.
improved. And so
So I lost some weight.
more energy in
I
the
had
day.
been on day 15 of no snoring at all. Zero
Yeah.
snoring. Not with a CPAP, not
No.
with artificially
Right.
but I'd literally stopped the snoring
Yeah.
and lost the weight. And I'm like, oh, I should check my blood pressure. I am too low.
Yeah.
Now my blood pressure is like way low.
Yeah.
And I'm like, what the heck? And I get off the blood pressure medicine. And the next thing I know, my blood pressure's right. And I took it right before I came here. Right in the
Oh, you took your blood pressure.
blood pressure.
Yeah.
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 Not the medicine.
Yeah.
I haven't been taking the medicine for a while now. But my blood pressure is right in the sweet spot. And I'm like, oh, doc, you were trying to put pieces of duct tape over something about your nervous system that was going too fast and sympathetic. Yes, it decreased it a little bit, but you had side effects because of it.
Yeah.
And then you never fixed the underlying problem. And once I fixed the underlying problem, it was amazing how the nervous system started coming around.
Yeah. Now, I do want to say
Go ahead.
that you are a pretty darn healthy individual. So us doing
Thank you.
some of our own doctoring is a safe thing. There are people who have blood pressure issues
Yes,
that need to be on
definitely.
blood pressure medication. So we're definitely not saying like everybody, get a wedge pillow and you can stop
No, no, no,
taking.
no.
No, not at all. But what we're saying about Doc is what we're finding out is he wasn't broken. Okay. So it wasn't that he needed the medication to fix something broken. He needed to support his system, and then his body was able to use its own compensatory mechanisms. And I mean, we know because of what we know about the brain, but if you're sleeping better, holy cow,
Yeah,
what are you
it
doing
changed
to your
everything.
morbidity,
Yeah.
mortality even? So it's just a huge, huge game changer.
And I would say what was the beginning of that was we started measuring things.
Yes.
I was measuring my oxygen saturation, I was measuring my snoring,
Yeah.
and that allowed me to measure. And that so when we talk about these assessments, like come and get assessed, we're talking about get to the root of the problem and figure out what's going on.
That's right.
And I think
It's time for the 2-minute drill.
let's go. Ding 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 ding.
Okay.
2-minute drill.
We had to wrap that up quick because we're just under 2 minutes
Okay.
already.
So here we go. I'm going to talk about this. This is what I want to challenge you. Okay. Medicine is good in a certain place. It's kind of like an ambulance. It gets you from point A to B. But if you're still in the ambulance 2 weeks from now, 6 weeks from now, 6 years from now, and you haven't fixed what's going on, the ambulance can become counterproductive because you're not getting to the issue. So the challenge for the 2-minute drill this week is I want you to look at all the different things you're taking, all the pill bottles you're opening, okay? And you're just taking them randomly, okay? And you're not stopping and thinking, how is this affecting my autonomic nervous system? And not just for you. What pill bottles are you opening for your child? Which ones are you opening for your parents who are elderly and taken care of? And start thinking about it. We don't want you to do anything elaborate. Nobody flush or anything down the toilet or anything. I just want you to look at them and I want you to go read the side effects and start to say, does this push my autonomic nervous system into sympathetic or is it pushing me into parasympathetic? And what else do I need to be doing to move the needle on the most precious thing I have, which is my brain?
Yeah, that's really good, Doc, because last week our 2-minute drill was about thinking about where you are on the dial.
Yes.
And now we're adding another dimension to that is thinking about what you put within you that affects where you're at on the dial.
Let's go.
Yeah, let's go. Your brain matters. Stop, think, and breathe.
Ooh, I love it. Let's grow.